Welcome back to the OHSU Effect Inside Health and Science. I have 3 guests joining me now to discuss a pilot program involving OHSU and 13 other health groups. It's called High Value Patient-Centered Care. The goal is to improve care and save on health costs. With me now is Debbie Lamberger, Ambulatory Care Manager and the project manager of this, and Sage Milton and Andrew Applegate, both nurse care managers. Good morning.
Good morning.
Hello.
Good morning.
So, Debbie, let's start with you. What is the High Value Patient-Centered Care Clinical Demonstration Project?
It's a project that's designed to improve care and reduce costs across the state. And as you said, we've got 14 medical groups. We also have a number of health plans involved that are participating in the state. The model is often referred to as a medical care home. It's a place where patients can think of it as home. They can call for any need they have. We want them to be able to see their primary care team as someone they can go to anytime they have any sort of medical need.
How does this work?
So we've got specially trained nurses in the clinics that act as navigators. They develop personal relationships with the patients and to help understand exactly how to best care for them. The care manager coordinates between all the members of the team, including the providers, specialists, hospitals, health plans. They're placed in the primary care setting, and they manage approximately 200 patients each. They do home visits. They meet the patient outside of clinic. They'll see them when they're in clinic. They'll do specific nurse visits with them. They really just become a partner with the patient to help manage their care.
So what kind of diagnoses and issues are your patients typically dealing with?
We have patients with all sorts of medical issues. Many of our patients suffer from chronic conditions like asthma, diabetes, hypertension, and depression.
How do your patients know when and how to contact you? I mean, how do they go outside the clinic and get their nurse care manager?
Well, there are many ways that the patients can contact the care managers, including direct phone line access into the clinic. There's secure messaging through electronic medical records. They can contact us on our cell phones via texting messages. And we give them different ways to contact us, including our cell phone numbers. They often reply, "Oh, I don't want to bother you," or "I don't want to call your cell phone number." But we want to encourage that because this is something we're trying to teach our patients. They're not a bother, and we're here for them, and we want them to see we want them to see us as a resource anytime they need anything from us.
How often do you interact with your patients, and what does a typical interaction consist of?
There really is no typical interaction because this is a project. It really varies. We interact with some patients several times a week. Others we might interact with once a month if that's all that they need. Different people have different acuity levels, so that's a big factor. And then as far as the interactions, there's not really a typical interaction. It could be anything from just a simple check-in of, "Hey, how are you doing with that weight loss goal?" We also do more planned visits where we've set visits up ahead of time with the patient, either home visits or in clinic, or sometimes we're even able to go to a place where someone's working if that's more convenient for them, to really have a more in-depth nurse visit. And really our main goal is just to meet folks where they're at physically, mentally, emotionally, and work on whatever their needs are to be their cheerleader in attaining their health goals, be their educator, help them navigate the system. So it really varies from patient to patient.
Let's talk a little bit more about the administrative side, I guess. I mean, how does this save money? And I know there's several different health groups involved, so how are you all working together?
So the nurses are working really closely with the patients to get them the right care at the right time at the right level. Oftentimes patients feel they can't get a hold of a clinic and their hold times are too long and they end up getting frustrated and going to the emergency room. By having nurses that they can contact directly through their cell phone, they can call with a question, they can call with a concern, and the nurses are great at triaging, working with them on whatever their medical issue might be, and they're able to help them focus on their health needs before they become acute and expensive. So not only are they preventing emergency room visits in the moment, they're preventing them in the long run because they're helping patients with their health goals, making sure that they are filling their prescriptions and taking their medications so that they can keep their hypertension under control. Just really kind of being a partner with them on their journey to better health.
How is this paid for?
So the insurance companies that identified the patients are paying on a prospective basis for the salary and cost of having the nurses in the clinics, with the goal that the reduced utilization based on improved health will save the insurance company money in the long run. So it's a partnership.
So this is just a pilot program. So what's the next step here?
Well, the next step, it's a 2-year project that will come to an end in February 2013, at which time we'll look closely at the data we've been collecting, and we've been doing a lot of data collection throughout this time, and evaluate the effectiveness of it. I think everybody who's involved with it now sees that it's already been effective. We have tons of great anecdotal stories of how we've helped patients and their families. And then hopefully we'll see the success and just be able to take the word pilot out of it and make it a permanent part of healthcare.
Yeah, I mean, how will you know that this is a success? Any stories that you'd like to share?
Sure. Well, I mean, we are tracking the data, so we're looking at cost effectiveness, which is one piece, but then just the anecdotal stories of how we've been helping our patients. We, both Sage and I, have many, many stories of success where patients just really feel cared about. They really appreciate the help navigating the system, being in better control of their health, really taking ownership over health promotion behaviors and integrating them into their lives. One example that I have that just happened fairly recently is a patient that I've been working with who He's been in the healthcare system for a while. He's got kind of some unexplained vertigo that has been difficult to diagnose and treat, and he's kind of hitting a lot of brick walls with his treatment options. And he's been told in the past by some providers about all of the things that he can't do, and has kind of heard too many horror stories. And I've been working with him and trying to understand why he hasn't followed up with some recommendations on just seeking out more specialty visits and seeking out continued care for this condition. And he said to me that he just got scared. He had too many people kind of shutting the door in his face or telling him things that either he couldn't do or could make his condition worse. So he just stopped following up with the recommendations for more evaluation. And through my relationship with him, because I've been spending a great deal of time talking on the phone with him, and visiting him in clinic, through my relationship with him, I said, hey, well, would it help if we explored this again if I was your partner there? If I could attend that visit with you and kind of take the burden off of him and be an advocate for him in that moment. And he said, yeah, I think that would be great. So we've got an appointment scheduled coming up to follow up on more evaluation for him. And it was really through building that partnership with him that we were able to do that.
That's great. Debbie Lamberger, Sage Milton, and Andrew Applegate, all with the High Value Patient Centered Care Program. Thank you so much.
Thank you.
Thank you.